Hello, everybody, and welcome back to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your summit host, Corey Ray Kovacs, registered nurse and women's wellness mentor and educator. And I am joined today with an amazing, powerful woman that I have got to get to know. And I am so excited to introduce you to Allison Locke. She is a traditional Chinese medicine practitioner and acupuncturist. She's an herbalist and integrative health practitioner based out of Vancouver, British Columbia. She's additional training in fertility and reproductive health. And as someone with stage 3 endometriosis, she is particularly passionate about treating chronic pelvic pain. Well, thank you, Allison. We're so happy to have you here in the summit. Welcome.
Yeah, thank you so much for having me.
It's really been fantastic getting to talk to you about your mission and how you love supporting women. And I would love for you to tell us a little bit more about your support for women, especially going through hormone challenges or other reproductive challenges like PCOS or endometriosis. Tell us more.
Sure. So I kind of got interested in hormones and reproductive health kind of on accident. When I graduated school, it wasn't the top of my mind as something that I wanted to focus on. But I joined a clinic and they happened to specialize in fertility and reproductive health. So I learned along the way. And then that's when I just became really obsessed with it. I was just so fascinated about everything: hormones, fertility, the menstrual cycle, how complex it was, but
Yes.
how much it interacts and affects our everyday life, and how little the majority of menstruators in the world know about their own bodies. And so that kind of really spurred my mission of, this is fascinating, super important information for every stage of life that every woman deserves to know.
It is. It's absolutely, it boggles my mind the fact that, like, I sit here and I look, I've been menstruating for 25 years and I feel like I've just barely scratched the surface in understanding what is up with my cycle. And honestly, I felt like I had to, before I even really cared a whole lot, like obviously going
Hmm.
through fertility myself. And then it took another 6 years for me to go to nursing school before I even got into like the hormones and how complex and really it's this interwoven very balanced process of feedbacks and how all the hormones work, and understanding that delicate balance and how much that impacts everything in our bodies,
Yes.
not just our reproductive but
Hmm.
everything. So
Exactly.
yeah, it's like I love that you're educating and sharing this information, because we need to know. We need to know how our bodies work.
Yeah, I completely agree.
It's it is really it really does empower you. And honestly, like, it brings, I know for me, it's brought back this whole entire sense of self-love. Like, it's just like loving
Mm.
myself on a whole new level, understanding how my cycle, how has that kind of like you, through this process of, graduating school and then getting into the hormones, how has that impacted your just kind of your relationship with yourself?
Yeah, that's a really good question because, yeah, I think once you learn more about hormones and you realize it's not just happening during your period, that's just basically the evidence of our hormones within our body. But really, our menstrual cycle, there's different fluctuations of different hormones happening at all times. And our period is basically a side effect of our fluctuating hormones. And so I think understanding that, and then understanding the physiological, biochemical impacts of those hormones, because
Hmm.
we have hormone receptors everywhere in our body, our skin, our digestive system, like
Hair
everywhere.
everywhere.
Exactly. Yeah. So our hormones, as they're fluctuating through our menstrual cycle, affect so many different things, our brain too, and how they interact with our neurotransmitters. So I think understanding that, like, we are really different throughout our whole menstrual phase
Hmm.
and our menstrual cycle, the different phases of it, that kind of helped me understand that, like, oh, it's okay to, like, feel differently, and
Hmm.
understand that I'm going to be a different person in different phases
Yeah.
of my menstrual cycle, and that's totally okay.
I think that so that's one of the things that I love to talk about in with the women I work with is understanding not only just the physiological aspects of it, but this energetic part, like your
Hmm.
emotions and your actual energy levels, like how tired
Yeah.
or energized you are, and then being able to adapt your life around and build your life around that is like game changer right there.
Oh, definitely.
It
Ultimate self-care practice.
oh my gosh, it's like, I mean, I can't believe how much like this love. I mean, love is like
Yeah.
the best way for me to put
Hmm.
to put it because it's like I was keeping all of this away from myself and I didn't even realize it. It's just kind of the product of, kind of society. I always come back to this commercial that I saw when I was in my mid 20s. It was I think it was a high brand tampon brand that used the slogan power over periods. And
Ooh.
I, so I realized, I don't even think I realized back then what that meant.
Mhm.
Obviously, a dude wrote it.
You're right. Just
But
power through, ladies.
power through. Yeah, go play, tennis and go
Don't let
ride
it
a
stop
horse,
you.
while you're wearing white, while you're doing what?
Right.
No, but that's the magical thing is like or the thing about it is that when you start learning your own language rather than kind of all this outside influence about how you should
Hmm.
feel during your period
Hmm.
or during any
Totally.
part of your cycle, then all of a sudden now you open the doors to create a life that supports you, that the nutrition that supports you at the different points in your cycle, and
Hmm.
how you can, your social calendar, your work calendar, and how you support yourself in all the different aspects of your life. It's absolutely amazing.
Yeah, definitely.
Speaking of eating and balancing your cycles, let's talk about cycle syncing. I This is a term that I know has kind of been a new term that's kind of been a buzzword lately, but I would love
Hmm.
for you to explain to us what is cycle syncing and how it can support us in using a cycle syncing practice and how that can support us through challenges like PCOS or difficulties with fertility.
Hmm. Absolutely. Yeah, you're totally right. Cycle syncing is a very hot topic
It's
right
kind of a
now.
hot
It's
topic.
definitely a
Yeah.
buzzword, which I kind of love because kind of what you were talking about before, like we are always programmed as our hormones are something to be overcome
Yeah.
and to just power through, as opposed to something to embrace and
Working with.
understand.
Yeah.
Yeah, and I think there is this current shift right now that I think is really doing a lot of favors to a lot of people who menstruate. But basically, cycle syncing, it means aligning your diet, your lifestyle, exercise, your schedule with the fluctuating hormones of the menstrual cycle. So it's all about living in accordance with these hormonal fluctuations to optimize your life through their biochemical and physiological effects.
Hmm. So how does that, say somebody is brand new to this concept of cycle
Mhm.
syncing, what benefits are there to them to making changes in their life that more fits along with their cycle?
Yeah, so basically, like, for example, when you start your period, that's basically your hormonal baseline. A lot of
Hmm.
your majority of your reproductive hormones are kind of, have gone back to baseline. And that can be when a lot of, mood or energy levels are low. And that's the time that we should rest and kind of recuperate and take a break from stuff if we feel like it. It's all about, checking in with yourself.
Hmm.
And I think that does us a lot of favors because then we're not just like pushing through moments when our body is telling us that it's
Hmm.
okay to rest and that we actually need the rest because our body's always communicating with us. And it's really often evident through our hormones. If it's
Yeah.
our body's giving us signs that, like, oh, we're hungrier, so we need more calories, that's a very natural thing in the second half of your cycle before
Mhm.
your next period and after ovulation. And instead of thinking, oh, what's wrong with me? I'm doing something wrong. I'm experiencing this symptom. I'm tired. I'm less motivated today. Or maybe one day I want to do all the social things and then the next week I don't. And then feeling guilty about it or just like
Mm.
confused and what's wrong with me and doing all this self-blame talk. And then So I think it's just like this really valuable thing to understand that like, oh, our hormones are wildly fluctuating throughout our menstrual cycle, and this has such a huge impact on everything. And life can just be so much easier if we understand some of these basics and then we enact them in our daily life.
Yeah, it's you mentioned the increase need for calories during the second
Hmm.
half of your during your luteal phase and menstruation, kind of leading into that. I
Hmm.
think this is a really, really important piece because especially if, when you're going through PCOS, weight is a challenge. And often, so
Hmm.
often these women come to fertility clinics or they want to, try to start a family. And the first thing that providers tell them is, you need to lose weight. And so they
Yeah.
put themselves on these caloric restrictive diets,
Hmm.
and it's in oftentimes not only is it creating stress, but then you're not supporting the changes in the hormones that are going through in those different parts of your cycle. um
Exactly.
so even just understanding that piece right there, that you
Yeah.
do have an increased need in calories at the second half of your cycle, so
Hmm.
after ovulation and before menstruation, that you might have an increased appetite, and having additional calories, protein, is
Yep.
a great way. A little bit increase, healthy fats like avocado or coconut oil. As long as those things don't have sensitivities. But it's this understanding that we are supporting our health through our cycle and letting our cycles guide us and listening to
Hmm.
our bodies to guide
Yeah,
us through that.
exactly.
That's such a fascinating thing. You also touched on guilt. Let's talk about guilt when it comes to how we run our lives. Um,
Definitely. That's a big one,
what's
I think, with health issues in general, are people that struggle with chronic health issues, because I find we often it's so easy to blame ourselves. Like, what
mm,
did I do wrong? Why can't I control my cravings? Or why did I have a flare up? Like, why are these things happening? Why is my PMS so bad this cycle? It's probably because I didn't do X, Y, Z. And I really want to like reframe this for a lot of my patients and people that I work with, that your hormones are just giving you signals and trying to communicate with you. Your body's always trying to communicate to you and try to making it obvious of what it needs and how you can support it. And it's honestly like, I think one of the most important things that I've learned with a chronic illness is that your body is always trying to do the best that it can with the
yeah,
resources that it has and the environment that it's in. It's never trying to screw up your life, make you
right.
feel awful. Like, your body's always trying to do the best that it absolutely can. And so I think having that like compassion for it, that,
Yeah,
especially because I've got some chronic autoimmune stuff too. And
mm,
so it can be really frustrating of like, oh, what did I do this time that caused my immune system to flare up? Is it because I was too stressed?
mhm,
Did I eat too much gluten, sugar, whatever it was?
right.
The first thing I think of when I have a flare up is, oh, what did I do this time? And I'm always trying to reframe this in my head and try to help my patients do this as well. It's
Yeah,
always a work in practice
it
of,
is
this is really
always.
just your body trying its absolute best. Yeah, and it just is a sign that it just needs a little bit more support. And there's always things that we can do to kind of help, bring some hormones and these things kind of back into balance.
Coming back from this place of gentleness and kind of nurturing this like inner mother and seeing yourself as this, I like to use the kind of idea of, there's a particular part of my phase where I call it my baby bunny day. So it's usually when I transition from menstrual into my inner spring or my follicular phase, and there's that one shift right there that I feel like the most tender thing, and that I could get squished at any minute by anything. So, whether it's my daughter or my partner or
Hmm.
somebody honked at me funny when they're driving, like I literally feel so fragile, and
Yeah.
understand, like getting to understand that my body just needs extra support at that time
Hmm.
during that kind of transition from that baseline, as my hormones start to increase, and understanding that it's okay for me, because my body says, hey, you need a little bit more support today. It's doesn't mean that I did anything wrong. It doesn't
Exactly.
mean, yeah, it doesn't mean that. It
Hmm.
just means that she's talking to me. Like I always refer to my
Yes.
body as a she. like personifying my body and my cycle and all these like different aspects of myself have really kind of been a game changer, because now I get to develop a relationship with,
Yeah.
and it does, when you, what you're talking about is like you're building this beautiful relationship where maybe you didn't have one before, and
Hmm.
cycle seeking is such a fantastic way to do that in a way that
Yes,
makes sense and is kind of structured. It's structured, but it's
absolutely.
also individualized because you're the one
Yes.
creating that for yourself. So I love this, and I want to talk about this later. So actually, Allison is going to be giving you her freebie, is this beautiful introduction into cycle syncing. I'm so excited. I wanted to mention it now because we're talking about it right now. So make sure, for those of you in our audience, make sure you check out her free gift on cycle syncing, how to align your hormones and optimize your life. Make sure you check that out after the show because it is top notch. It is so beautiful and I love it. And
Oh,
it's
thank you.
chock full and it's so generous with and I love that you're giving that here. So I wanted to drop that in, but of course I'll have the link for that at the end of the show. So let's kind of shift gears a little bit. I would love to talk about your acupuncture practice.
Hmm.
And I know that this is a significant part of your practice. So how can acupuncture support those going through their fertility journey, whether they're just at the beginning of their stages of trying to conceive, or they're kind of in the middle with fertility medications or other modalities, or even IVF? How can acupuncture kind of support those different places for those going through those processes?
Yeah, that's a great question. So, I mean, I love acupuncture for all sorts of conditions and hormone imbalances. What it basically is, for people that need a little bit of
Oh, yeah,
background,
please.
acupuncture is basically just inserting hair-thin needles at various points in the body to elicit a physiological response.
Hmm.
So, some of its general mechanisms are it's really great for increasing blood circulation. It
Hmm.
activates the parasympathetic nervous system, so it's really great for relaxation. It reduces inflammation, it supports hormone balance. All of these things are why acupuncture is so
Hmm.
effective. And then I do particularly love it for people with PCOS because it really helps to regulate the HPO axis, or
Hmm.
the hypothalamus pituitary ovarian axis, which is basically how your brain communicates with your ovaries and tells them when to start growing follicles, when to ovulate. And this is really important for people with PCOS because they often struggle with regular timely ovulation.
Yeah.
And then with PCOS, we also want to like reduce the inflammation and support healthy egg quality and balance hormones, particularly stabilizing glucose and insulin levels and reducing androgen levels, depending on how
Mhm.
PCOS is presenting in your body. And so all of these things are uh, what acupuncture and traditional Chinese medicine is really great for.
Hmm. So I love that there's so many things that we could support those with PCOS, particularly, regulating that HPO axis. I mean, we've talked about
Hmm.
it a little bit on the show, but really, your hormones are like your messengers. They're the ones who are carrying the messages, and
Yes.
it's not just your ovaries. This isn't just a reproductive. This is a brain function, and we know that we have our ratios of LH to FSH, which are your luteinizing hormone and your follicle stimulating hormone, are all out of whack, and really affect when you ovulate. And that's why we end up having such long cycles in that.
Hmm.
So having things like that, like acupuncture, to support and regulate that axis and regulate those hormones and how they're speaking to each other and speaking to your ovaries, is extremely important. And in some cases could be the difference between having a regular cycle or not, is like getting those hormones
Yes.
talking to each other, to getting the hormones and the receptors talking to each other, and everybody working in sync, because it
Hmm.
is a well orchestrated dance of
Yes.
hormones. So specifically about IVF, how does acupuncture support those going through IVF?
Right. Yeah, so acupuncture, it's been shown in a lot of research to improve uterine and ovarian blood circulation, reduces inflammatory cytokines, and helps to regulate the menstrual cycle and the nervous
Mhm.
system. Because one of the biggest impediments for conception for people with PCOS is that regular ovulation
Mhm.
component. And then, so for IVF, basically, some of the major studies show that acupuncture and TCM can improve your pregnancy rates by about 30%, which
Mm,
is crazy
significant.
huge for people that are going through IVF. So it's something I always encourage people, no matter if they have PCOS or not, always
Mhm.
get acupuncture with your IVF cycles because it can just really it'd be really great for your results.
Yeah.
And it also has been shown to decrease miscarriage risk too if you get
Yes.
acupuncture with IVF as well. Um, and so I know people always ask me about how many treatments do I need? Can I just do it once? Do I need to do this for like a year for it to be effective? And, you know, a lot of the studies kind of don't always agree with how many treatments make the difference for IVF. Like some, studies say it's 3 treatments, some say 8 to 12. I personally see the best results when patients do about 9 to 12 treatments
Mhm.
in the 2 to 3 months leading up to their egg retrieval, along with a
Mhm.
handful of treatments, maybe about 4 to 6 before their transfer.
Mhm.
So, but I do also want to say that like any treatment is better than nothing because if you
Right.
don't have like the time or the finances for all this, that is totally fine. Because there was actually just a recent study published a couple of months ago that showed that even less than 4 treatments before an embryo transfer also did some positive effects.
Oh,
So really anything is better than nothing. And there's also like great community style acupuncture options. But I do like to see um, acupuncture and getting some treatment and doing some great stuff like about 3 months leading up to your IVF cycle, because
mm.
3 months is kind of that golden period of
Yes.
time where you can make like that significant difference in egg quality. And that's just because that's based on how long it takes for the maturation process of an egg before it ovulates. Because an egg takes like about a year-ish or so
Mhm.
to do its maturation process, but the last 3 months are the most important. So that
Right.
basically means everything that you've done in the past 3 months is affecting the health of the egg that is ovulating this menstrual cycle. So in an ideal world, I love a good 3 solid months to make some really awesome positive changes.
I think that's so important to recognize is this time component. I know that sometimes we live in a culture, we live in a microwave culture, right? That wants
Yeah.
things right here, right now. And unfortunately, our traditional kind of healthcare path, especially infertility, tends to
Hmm.
kind of do that. I know personally, like I had no time to or any recommendations of how to improve my nutrition or my health before. Basically, they just put me right into the kind of pipeline and started taking
Right.
medication. And so
Hmm.
it's not that, obviously my journey is my journey and I don't regret my journey, but I do
Right.
know that if I had had more information, I might have made different choices about
Yes.
how to take care of my body, how to better prepare, because that
Hmm.
preconception phase, that 3 to 6 months before is huge for not only the woman, but for the men as well. This is
Yeah, definitely.
they're also in this. So
For sure.
sometimes we kind of forget, like we're talking about PCOS and things like that, we kind of forget that other part. But that part right there is like bringing back to this gentleness of time and
Yeah.
realizing that sometimes taking a step back. I know we want to start families. I know that we want to
Hmm.
have that baby in our arms, especially when we're, if all our friends are getting pregnant and it's,
Yeah. Yeah.
that's really difficult. So giving yourself the time that you need to heal your body that may have been having some really hard times over the last years, many years, maybe,
Hmm.
to understand that this, receiving care like acupuncture can support you in improving that egg quality. And the better
Yeah.
the egg, the more likely it is that it's going to result in a healthy embryo and a
Yeah.
healthy, pregnancy leading to a healthy baby. It's not
Exactly.
just getting pregnant. We want to stay pregnant and we want to have a
Yeah.
healthy pregnancy for everybody after that.
Exactly. It's definitely like an investment period. of
Yes.
time that it can be really great. I mean, even if you're trying naturally or doing IUIs or
Yeah.
IVF, like that preconception care time can be so good for helping you fall pregnant like easier and faster when the time does come. So it is a really great, valuable time.
It is interesting too that what it not I don't like to ask the whole what ifs, but just like taking this step
Mhm.
back and saying, how can I support my body right now? And are there changes that I can make that may change the course of how I'm going to have to do this from now on?
Yeah.
Right. And because ultimately, IVF is a huge commitment in all the
Hmm.
ways. It's emotional, financial,
Yeah.
physical. It
Yeah.
and so if you're at that point where maybe you haven't reached that decision yet, you and your body and your health might be just a thought. It might be worth the time to sit and make some changes to help support you and your health before you get to that step. And if you're already there, that's okay too. There are things that you can do. I want
Hmm.
you to always feel
Definitely.
empowered as a, if for those that are listening, I want you to always feel empowered that you can do things and seeking, care from an acupuncturist, especially someone like you who specializes in fertility. You have
Hmm.
that training and that passion, and I think that's a huge component when you're looking for somebody to work with. Um, so I would love to just kind of touch a little bit about to get a little personal, touch a little bit on your journey through endometriosis.
It's a big word.
And yeah, it's great. It's great. It just rolls off the tongue. Through endometriosis and also, your other kind of health challenges
Hmm.
and how having a chronic diagnosis can affect all the different parts of you, the physical, the mental, the emotional, the spiritual, all these aspects. So, how have you worked through these challenges and really kind of come back to loving yourself through this process?
Yeah, I mean, that's always consistently a work in progress with
Always.
life. So I I was diagnosed with endometriosis actually after I started working as an acupuncturist specializing in fertility. So I kind of had a unique experience where I was kind of basically accidentally diagnosed. And so basically I was accidentally diagnosed with a disease that I treat every day at work. And so it had like this it was very difficult to kind of gather because as
Right.
soon as I got my diagnosis, I was like, whoa, I know too much. And that actually
Mhm.
is kind of more harmful mentally and emotionally because immediately all the stats were rolling in my mind. And I'm like, okay, this is okay. I let myself have like my grieving period and I like really let myself feel my emotions, feel completely sorry for myself. And then once I, let everything out and I moved through the motions, I kind of just picked up myself again and was like, well, if anyone's going to get endometriosis, it's great that it's coming from a fertility specialist. So then I just started like, okay, well, I know exactly what I need to do. And then I just started slowly incorporating steps of all the
Mhm.
things that I need to do with naturopathy, acupuncture, Chinese herbs, supplement, changing diet and lifestyle,
Mhm.
seeing other specialists like pelvic floor physiotherapists, uh, gynecologists, just like all the things. I created my healthcare team, which I think is a really important thing that we need to do to navigate, any kind of chronic illness in
Mhm.
modern society. And I just started slowly, experimenting with different things, figuring out what works, what doesn't for
Mhm.
me, because everyone's body is so individual. I found the things that kind of work for me, and I just try to remain as consistent as I can with it.
You brought up such a huge point. Well, first off, thank you so much for sharing that very personal part of you. I know so many of us have had these personal things and kind of drive what we do, and why
Hmm.
we're so passionate about this. But you mentioned building a healthcare team that fits you and
Yeah.
realizing that there is more than one option of healthcare modalities and that getting these different aspects may be the best way
Hmm.
to support you. That it's not just
Definitely.
right because there's so many different facets of ourselves. And
Yeah.
honestly, being able to rely just on one person for I like to I like to think about like a concert, right? Like
Hmm.
you're putting on this huge production and you have the singer, right, who's like the star, but look at all these different people that support them to make their mission possible, right? To put on the show. You've got this backstage crew, you've got the the people that are playing the instruments, you've got the lighting, you've got
Yes.
the venue, right? You have all these people that are on the team that maybe that all have different specialties and all have come at this mission from a different point. And I
Hmm.
don't understand why we don't take our healthcare that way. Um,
Oh, I know. It's so true. Because I mean, I also feel like, especially because I mean, Western allopathic
mhm,
medicine is so specialized. And I do hear so often that like people go to their family doctors and complain about period hormone stuff, and they're just met with like, well, what do you want me to do about it? Here's birth control. Maybe they'll send them a referral to a gynecologist, and they're often really disappointed with the experience. And I think we just put too much pressure on one particular medical professional for being our
yeah,
answers to everything, when I don't
yeah,
really think that's necessarily really realistic with chronic health issues or a complex, health issue
mhm,
or something related to hormones or a menstrual cycle. So I think it's so important to have that family doctor to get some of the basic stuff done, like
mhm,
have a gynecologist you can get to for some specialized hormone care, like see an acupuncturist or a physio if you've got like pain issues or other kind of imbalances. If you see a nutritionist or a dietitian for their specialty, like I think that's how we get the most effective medicine is if we kind of grab and hold on to some specialties of each kind of holistic thing going on in the body so we can get the best care for everything that we need for our health, because all of our health conditions are holistic. Like PCOS is not just connected to
mhm.
our ovaries and uterus. Like it's a very whole body disease. Same with
Very. Yeah.
endometriosis, same with autoimmune
Mhm,
diseases. So I think it's just so important that we're utilizing a healthcare team and trying to get the best from everything. And I also do want to mention that, like, I understand that this is a huge privilege that not a lot of people are able to. But I do think it is the way our modern health care system needs to
mhm.
function, and it's going to function the best way in this kind of model.
Certainly advocating for yourself is a huge way
Mhm.
that you can make kind of waves. So like me personally, I receive the vast majority of my care through the VA, because
Mhm.
I'm a veteran. And so that is very they do a great job of supporting us, but at the same time, it is sometimes challenging because there is so many. So other people that are going through other public health or government led health care, is understanding that you taking this piece and bringing this information to your practitioners and saying, hey, I think I need some more testing done, or by educating yourself and realizing you get to be the advocate and pushing for those things, really becoming more active instead of a passive
Yeah.
participant. You're becoming an active participant in your health. So even if,
Yes.
yeah, you don't have access to all of these things, and obviously, yeah, privilege is a huge part of it, but even just this step of becoming an advocate can make a huge
Yeah.
difference in the type of care and the quality of care that you're able
Hmm.
to get from your practitioner. So I always support and encourage health advocacy and standing up
Yes.
for yourself. So,
Absolutely. That is a
um,
huge important part. And getting second opinions and
yep.
just not
Mhm.
giving up and waiting until you find there's going to be a practitioner out there that
Yes,
will be able to help you. It's just a matter of
totally.
time before you find them.
Well, this has been a absolutely delight, a fantastic conversation about so many things that I'm truly, truly, truly blessed that you have been a part of this, and I know that our listeners will feel the same way for sure. Of course, I already mentioned Allison's gift, the cycle syncing, align with your hormones and optimize your life. You can access that gift again right after this interview. I've got that link in the email, so make sure you check it out. And Allison, I did want to ask just one last little parting piece that we can leave our audience with. So, what is one inspirational thing that you would say to a woman experiencing fertility challenges with PCOS right
Ooh, okay. I would probably say, well, first of all, to never give up on finding that practitioner that can help you and support you in the way that you want.
Mhm.
But then also, I kind of say this in general for like all health issues, is that there is always something else that you can try, something you can add, just like there's always something you can do that has a potential to help your symptoms and everything. Like, I just don't want people, I hear all the time, like, oh, I have endometriosis, so I'm just going to have period pain for the rest of my life. This just like acceptance of these issues, I think is really, it's really hard. But yeah, I want people to know that I promise you, there's always something you can do. Even if it's something small, it's a little bit of change, a little bit of something, there is
Yeah.
something that can help.
And you are always worth it. You
Yes.
are always worth that time and that change. You are
Yeah.
worth that, because that is one of the ultimate ways that you can show your
Yeah.
self-love is taking care of your body and supporting her. So thank you so much, Allison. It has been an absolute pleasure, and we look forward to speaking with you more soon.
Yeah, thank you so much for having me. This is really fun.
All right, take care.